Andrea Jackson, Clinical Program Manager, shares her story and the importance of health equity.
When I became a community health worker and worked with Medicaid recipients one-on-one, I heard countless stories of the racial inequality Black people faced in the healthcare system and was extremely heartbroken. One story that really stood out to me was that there was a client who I was working with who continuously shared her symptoms with her doctor, but her doctor was not taking her seriously. She repeatedly explained to her doctor that she wasn't feeling well, and later she was diagnosed with a serious medical condition that could have cost her life. And how many stories have we heard that are similar to this? This is just one mere example. So, to learn more about how I could break the chains of racial inequality and improve health equity for Blacks, I pursued a Master of Public Health. I learned that health equity was a bigger issue than I realized, and many barriers needed to be broken to better our broken system. Graduating with a master's degree in public health, I realized that I needed to change the health system directly instead of working one-on-one to help Medicaid recipients close gaps in their health care. What I began is educating our health leaders on the importance of addressing Black wellness and the disproportionate health disparities among Blacks, and that literally has been my greatest joy in my role. I really would like to encourage everyone to educate themselves on the inequalities, the disparities, and the gaps in our healthcare system, and to get involved in making changes that break the cycle and challenge of our healthcare leaders. I really want to encourage our healthcare leaders, if you're on the call, to do the same. I'd like to say that I'm endorsing this work that Momentum is doing, as this is not just a one-time thing. It's not just a one-time event, but they're committed to community events that support Black wellness. I ask you to join me in supporting Elevate Black Wellness.